Colon cancer is a potentially life-threatening condition. According to the American Cancer Society, it is the third most commonly diagnosed cancer amongst both men and women in US. But there is hope in beating it, especially on the basis of early detection. Timely recognition of symptoms makes the prognosis and treatment of colon cancer easier. Awareness, vigilance, and timely action. That is what you got to do. In this video, we are going to talk about the critical symptoms of colon cancer that should never be ignored. These symptoms are rather signals that urge us to take action and seek medical attention before it gets too late. Blood in stools. When you notice blood in the stool, don't take it lightly. Never ignore, though the presence of blood can be due to multiple reasons like hemorrhoids, anal fissures, or gastrointestinal bleeding. These conditions are concerning but are not linked to colon cancer. However, gastrointestinal bleeding occurs from different parts of the digestive system, which includes the small intestine and the colon. Thus, the crucial step here is to identify and recognize these causes and understand when to seek medical attention. The type of blood can also help guide you better. For instance, bright red blood in the stool points at the bleeding near the rectum or the anus arising from hemorrhoids or fissures. In contrast, dark blood or black stool indicates bleeding further up in the digestive tract coming from the colon or the stomach. Abdominal pain or discomfort. We are sure you are already wondering that abdominal pain is a non-specific symptom. Yes, you are right, since it occurs in various conditions other than colon cancer. We are well aware of the widely prevalent gastrointestinal issues such as irritable bowel syndrome (IBS), diverticulitis, or gastritis. All these conditions lead to abdominal discomfort. However, in the case of colon cancer, the abdominal pain is accompanied by other symptoms like habit changes, blood in stool, and weight loss. All these symptoms, when appearing together, needs medical attention. Unexplained weight loss. While we are all fascinated with losing weight, there are certain conditions when this becomes alarming. Healthcare professionals consider weight loss of more than 5% of one's body weight over a span of 6 to 12 months to be unexplained. And this unexplained weight loss is no joke. You need to check for a persisting health issue. And yes, colon cancer leads to unexplained weight loss for a number of reasons. The existing tumor can hinder the absorption of nutrients in the colon that leads to nutritional deficiencies. In addition, it is a natural response of the immune system towards fatigue. When it comes to colon cancer, the fatigue associated with this illness is not just a feeling of weakness. Rather, it interferes with the daily activities and obstructs the quality of life. It goes hand in hand with weakness and lack of energy, linking to anemia. Now, what is anemia? It is a condition with lower hemoglobin and lesser red blood cells. Anemia can be a result of colon cancer, where the tumor causes bleeding in the gastrointestinal tract, leading to iron deficiency and a decrease in red blood cells. This automatically results in the decreased ability of the blood to carry oxygen, and hence fatigue results. Anemia. As mentioned before, anemia is a major symptom of colon cancer. It is a condition in which the lack of red blood cells present is unable to provide adequate supply of oxygen to the body's tissues. It can also exist because of other nutritional deficiencies, diseases, and bleeding disorders. In the case of colon cancer, however, results in loss of blood and hence a decrease in red blood cells and the consequent supply of oxygen. Some of the obvious symptoms of anemia are fatigue, pale skin, cold hands and feet, and shortness of breath. Constipation is a common digestive complaint that you would hear from a 2-year-old to an 80-year-old. Constipation involves infrequent bowels or difficulty passing stools. Constipation often resolves by dietary changes and lifestyle adjustment. However, it causes concern when it becomes chronic and arises along with other symptoms. If you experience this for long, it might point at the tumor in the colon that obstructs the normal flow of stool. Diarrhea. While at one hand we have constipation, on the other we have diarrhea, which is again equally important. Persistent, unexplained diarrhea includes frequent watery stools. It can result because of infections or maybe dietary habits. At the same time, it is also a major symptom of colon cancer. While the tumor obstructs the colon and results in constipation, it may also result in an increase in the frequency or looseness of stools. Diarrhea often results in dehydration and nutritional deficiencies and should not be ignored. Remember, friends, your health should be your foremost priority. Any ups and downs or any chronic symptoms should never be ignored. If you or any of your loved ones face the above-mentioned symptoms, it would be best to consult a healthcare professional. We are always here to guide you to take the right decisions. We hope you liked today's video. Hit the subscribe button. Stay vigilant, stay healthy,